teman-teman sekalian, saya Pater Sauris Vidi. Saya sedang ada bersama psikiater dokter ahli jiwa dari Jerman. Saya akan wawancara dia sedikit, kenapa dia bisa sampai datang ke Flores untuk mengunjungi saudara-saudari kita yang menderita gangguan jiwa. Dia ada di sini sejak 1 Oktober dan hingga hari ini tanggal 12 Oktober. Besok mereka akan menuju Labuan Bajo untuk saya kira lekas kembali ke Jerman. Dr. Wolfgang.
Ja,
Okay.
betul. Dr. Wolfgang Karl from Munich, Germany. I have been working for 40 years as a psychiatrist now. I have worked in Malaysia many years. I actually worked in Malaysia. Saya boleh bercakap sikit-sikit bahasa Melayu.
Oh, bahasa Melayu. Okay.
Bahasa Melayu, sikit bahasa Indonesia juga. Tapi sekarang saya mau bercakap dalam bahasa Inggris. So, as a young doctor, I was sent by the German Volunteer Service to Malaysia, where I worked in the largest mental hospital, which is Hospital Bahagia, and had 2,800 inpatients. And at the worst times, we were 10 doctors only, and at the best times, we were 18 doctors. So I'm used to work in conditions where you don't have too many staff. But maybe, and then I was working, of course, in Germany. I was working in rehabilitation, in acute psychiatry, and then I came here because Dr. Anke Böckenförde, who had worked for 5 years in Jakarta, had asked me if I come along. And then I agreed, and I'm very glad that I came to Flores, and I'm impressed by the work that some lay people together with Puskesmas are doing. Yeah, I actually had the chance to see many patients, to discuss with the keluarga, with the family. I had the chance to talk to patients, and of course to KKI members, to nurses, to doctors, and I think they work very well together in improving the situation of the severe mentally ill.
Ini di sampingnya ada penerjemah, Ibu Hani Kumala dari Jakarta. Dia psikolog klinis dan sudah sering datang ke Flores, kunjungi saudara-saudari kita yang menderita gangguan jiwa, dan dia temani Dr. Wolfgang ke Flores. Kurang lebih singkatlah Mbak Hani.
Tadi Profesor Wolf bercerita tentang perjalanan hidupnya, pertama kali menjadi psikiater di Malaysia selama kurang lebih 10 tahun, bekerja untuk 2.800 pasien dengan 10 dokter. Dan hal itulah yang membuatnya juga memiliki kepedulian ketika kesini, dan beliau sangat terkesan melihat betapa orang-orang di Flores itu peduli dan mau bekerja sama. Teman-teman dari KKI, perawat, semuanya komit untuk peduli pada orang-orang dengan gangguan jiwa. Kurang lebih begitu.
Oke, Dr. Wolfgang, temukan sekian banyak kasus pasung di Flores, di beberapa kabupaten. Menurut kamu, soal perasaan, kesan, dan layanan medis terhadap mereka itu seperti apa?
Your suggestion and your commenter about the people in
About pasung, okay.
Of course, I mean, for a psychiatrist like me, it's of course first shocking to see that, but then we have to understand why the situation is like that, and the situation is like that there are not enough people qualified to treat these people well. So we have to see. I spoke to the keluarga, and there were quite a number of people who are in Pasung who threatened to kill their parents, the mother, the father, the adik, and so on. And today I was very shocked. I met Ibu, and she was about 66 years old, and she was blind on one eye and she couldn't hear. And that was because her son slapped her so hard that she lost her eyesight. But she was still positive towards her son. What I think is, of course, we can treat if we have the medication. If we have the medication, then we can treat successfully 90% of the cases. Maybe 10% are treatment resistant, but all the others. And that is what I learned. The problem is not the patient who is in Passung, it's not the family, it's a missing medication. For example, today, we had a meeting with families. There were about 8 different families, and they all told me the same, that at the moment their relatives are not doing very well, and 3 had to go back to Passung because they don't have the medication, and Puskesmas don't have the medication. The problem does not lie with the Kapala of the Puskesmas. They were all very cooperative, but they told me they are not getting the medicine. So my suggestions would be, first of all, you have to make sure you have the medication. And from my understanding, and I ran a very successful program in a rural area in Malaysia, the most important thing was that we had depot neuroleptics. For example, haloperidol decanoate. And if you have that, you have to give an injection every 3 or 4 weeks, and most of the patients respond well. And I had the chance to talk to some patients, and they said they liked that depot preparation, and the family also said they were well, as long as they could get it. But then somehow it stopped, and then again they had a relapse, and this is a problem. If you have continuous medication, then many patients should be able to be at home and to do some work. Yeah, they can, for example, help in the garden or raise babi and so on.
Oke, jadi Wolf itu tadi terkesan ketika dia harus melihat orang-orang yang dipasung. Satu hal yang paling diingat adalah ketika ada seorang ibu usia 66 tahun kehilangan penglihatan dan pendengarannya karena ditampar sama anaknya sendiri. Tapi sekalipun seperti itu, ibu tetap sayang sama anaknya. Dan menurut Profesor Wolf, yang diperlukan adalah obat injeksi, right? Depo, karena itu efeknya bagus dan sebaiknya bisa diberikan setiap 3-4 minggu. Masalah utamanya bukan cuma tentang keluarga, bukan tentang ODGJ-nya, tapi tentang penyediaan obat. Kalau obat itu ada, maka 90% pasien akan dapat tertangani dengan baik.
How your impression about tenaga kesehatan Puskesmas?
No, in general, I had a very good impression of the nurses who were involved. I mean, one thing was good. Usually, every Puskesmas had 1 nurse or 2 nurses delegated, and they would do the work for the people with ilmu jiwa. So that was very good, and I was really happy to see how emotionally involved they were. I mean, you have fantastic nurses here. The problem, one of the problems I would say, we would need to train them better, but that is also true for the Dr. Umum, for the general practitioner, to have a better knowledge of psychiatric problems and the treatment.
Wolf terkesan sekali dengan para perawat petugas kesehatan yang ada, karena selama kami kunjungan, semua perawat itu sangat komitmen, bukan hanya karena tanggung jawab, tapi mereka pun punya keterlibatan emosional sama para pasien. Dan juga dan diperlukan juga pelatihan. Perawat itu sudah baik, tapi akan lebih baik lagi kalau mereka mendapatkan pelatihan, dan juga para dokter umum gimana mendiagnosis dengan benar dan gimana memberikan treatment dengan lebih tepat.
Di Jerman ada pasung atau dulu pernah ada pasung?
Oh, I think we have some cases, but we don't know about it. But we don't need Passung, because what we do is, if a patient is aggressive, Then he is brought usually by the police, and then they can be treated. And if they continue to stay aggressive, actually we have some sort of a clinical Passung. They are restrained. We have a bed, and then they are restrained with their hands and their feet, and they cannot move. Yeah, and also around the waist. They are really. They can move less than the patients in Passung. Yeah. But this is usually only for a couple of hours, but sometimes for days. And of course, if someone threatens to kill or even kill someone, then he is put for a long time into a forensic unit. We have special forensic units, and that's where Passung for a short time. I mean, medical Passung, you could say.
Medical treatment.
Yeah, it's not really a treatment, but it's if someone is too aggressive and threatens the nurses and the doctors, what can you do? Sometimes we have to restrain. Yeah. But we should not restrain for a long time. And I can tell you, actually, when I started my work, that was in '87 in a mental hospital in Germany, we had many patients who were restrained for weeks. So you could say we had something like Passung, which we did not call Passung, but the effect was the same. They were restrained. And then we had programs. We were teaching the staff, and then the patients in the end didn't need to be restrained. So if you treat them well with medication as well as psychological, it's not only, Obat is not all, yeah. But if you treat and you train the nurses, then you don't need Passung. Also not in Germany. No restraint. Yeah.
Okay. Dr. Wolf, how about your impression about KKI volunteers?
Oh, I'm very impressed, I can tell you. I think they play a very important role, and also I'm impressed how they lay hands on. For example, I saw today how they cut the fingernails, how they shave the patient, and even mandi the patient and give him new cloth. So the patient was again very, very clean, and I know they do it. I tell you, this KKI is a great group. Also, I know them, we chit-chat together, and it's fun, you know. They also laugh a lot. They are not people who look like sad and so on, but they really enjoy working, and they give them hope. And what I think is the most important ingredient in really making progress is that you give hope. You know, if you are yourself hopeless, how can you give hope? You cannot. But if you have a personality, a positive attitude, and I saw that with all KKI members, great. I was really impressed, and I became friends with them.
Ini pertama kali datang ke Indonesia. It is the first time.
Bukan.
Okay. You speak in bahasa.
Bila saya bekerja di Malaysia, saya pergi ke kongres pertama kali 78.
Okay.
Pertama kali di Indonesia, di Bandung, ada satu kongres dan saya present a paper.
Okay.
Dalam ini kongres, I get to know a lot of important psychiatrists.
Congress psychiatric.
Yeah, for example, Professor Kusumanto. Yeah.
Bapak psikiatri Indonesia.
Yeah. Saya tahu dia
And
tahu saya.
it is the second time.
No, then I came. The last time I was in Jakarta was in 1995, again for a congress, where I presented some rehabilitation about 16-year follow-up of chronic schizophrenic patients, And what we found out was what was most important is that the staff doesn't change very much. The same nurses treat them over many years, and that you have the medication. And if you have that, your programs are successful.
Oke, Dokter
Yeah.
Wolfgang, terima kasih banyak. Thank you very much.
Okay.
See you next
Yeah.
next time or next
Tahun,
year.
Maybe next year.
Oke, teman-teman. Ya, terima kasih. Salam jumpa di lain kesempatan. Saya Pater Aven dan
Pater.
ini Dokter Profesor
Wolfgang.
Dr.
Okay.
Wolfgang.
Dr. Wolfgang.
Dr. Wolfgang.
Cukup.
Oke.
Tapi di Malaysia saya profesor.
Oh ya, oke.
Tapi Dr. Wolf is okay.
It's okay, oke.
Oke, terima
Terima
kasih
kasih banyak
Pater.
untuk perjumpaan beberapa hari di Flores bersama relawan KKI.